All right, well, welcome everybody to the retail panel testing series. This one's going to be chronic pain. This is a very, very cool test, I think. All right, so who needs this panel? People with arthritis and joint pain. You can read them: headaches, migraines, IBS, that's irritable bowel syndrome, feelings of pins and needles, people with fibromyalgia. You'll see that's bolded because we're going to talk a little bit about fibromyalgia in just a minute. Back spasms, stomach pain, unexplained pain. This is a great panel. The chronic pain panel is something that every physical therapist should consider, chiropractors, doctors, CBD stores, dispensaries, that kind of thing. Very important panel. First thing, let's talk about fibromyalgia. I think everybody probably knows what it is, but these are some things you may not know about it. Fibromyalgia is a very, very painful condition, and a lot of people go undiagnosed, and there's a reason for that. First thing about fibromyalgia is there's no cure. And guess what? No known specific causes. They make assumptions here. They think it's a combination of your genetics, your family history, possible infections, physical or even emotional trauma, like a car accident, or even PTSD can start this stuff up. And guess what? No cure, right? No known cause, so there's no test for it. There is no specific test for fibromyalgia. Can't find it with x-rays, can't find it with blood work. Some of the guidelines for diagnosing fibromyalgia, it's kind of interesting here, that before a doctor will even consider looking at fibromyalgia, you got to complain of widespread pain. Now that's going to be widespread in the most widest sense of the word. Both sides of your body, upper and lower half, pretty much everywhere. And you have to have been experiencing this pain or complaining about this pain for at least 3 months. Just think about these poor people. 3 months they got to go before they can even have their doctor consider fibromyalgia. It's ridiculous. It's almost in the dark ages. They also have to have, along with the pain, a complaint of fatigue or waking up tired, some cognitive issues here, trouble thinking. Now, the way they used to diagnose fibromyalgia was with an 18-point tender point test. So literally you would go to the office and they would touch you on your body, 18 different places, squeeze it or poke you, and if you complained that it hurt in at least 11 of them, then they would consider that you might have fibromyalgia. And with fibromyalgia, you have good and bad days. So if you were in a good day and they hit you, 8 different places it only hurt, if you were being honest, then they would say, well, you don't have 11, so you can't have fibromyalgia. So the way that they find it now is by process of elimination. They rule out everything else. I mean, that's everything else, which means that person's going to be exposed to extensive blood work and a multitude of other testing. So it's, hey, if everything else is figured out, then this must be fibromyalgia. Often fibromyalgia coexists with irritable bowel syndrome, migraine, other headache types, leaky gut or interstitial cystitis, or painful bladder syndrome. So it coexists with these things. Some of the risk factors that they think that they have figured out is that gender, and it's mostly women that will complain, will present with this situation. They also look at your family history, other disorders like rheumatoid arthritis and lupus. The treatment: drugs, lifestyle changes, some other therapies, physical therapies. I mean, it's just a whole new industry has been developed to treat this disease. People are really taking advantage of it. Chiropractors are saying they can treat it. Physical therapists say they can treat it. Doctors say they can treat it with pharmaceuticals. And it's just crazy, crazy stuff. So this pain panel, this test is going to look at 23 different variations. They're going to divide it up into 3 categories: inflammation control, chemical detoxification, neurotransmitters or pain control. Mutations. Inflammation. All right, before we get too far into it, Inflammation's bad, we're always taught, right? It's bad. However, inflammation can be good, because what inflammation lets us know is that we have stuff going on inside our bodies. So, of course, inflammation, we don't like it, but it's good to know that our immune system is doing what it's supposed to do. It gives us warnings. So here we go. Here comes the boring stuff, right? The C3 SNP that they're going to be looking at. C3, it's a protein that's very essential for immune response, and problems with this mutation can indicate asthma or other inflammatory disorders. CD14, protein, again, for pathogen response, and this is for environmental stuff as well. Carcinogens in the environment. Again, people with asthma and other allergies will be affected. The IL-1B, this helps to produce COX-2, which basically what COX-2 does is it helps develop the signals that our brain sends and receives from its nervous system. It helps create those pain responses, the actual signals that, hey, this is painful. The IL-5, 6, and 13, these are inflammation on switches. When certain conditions arise in the body, these things will, if they're mutated, inflammation flares up. Again, it's for allergens. The STAT4, it's another on switch. When this mutation is present, it's an indicator possibility for lupus and rheumatoid arthritis. The TNF, we'll spend just a second on this one here. Look this up, tumor necrosis factor. And basically what the TNF is I call this one the general of the immune army. Okay, so when we have a situation in our body that our T cells are summoned to respond to, and our white blood cells, the TNF actually is the general of this army. It will direct these T cells where to go now and where to fight. The problem here is if there's a mutation in the TNF, the general, right, he could turn the army to mutiny against your own body, start eating your own organs, and start eating your own body tissue. That's not the disease. It's very, very bad to have a mutation here. So with all these on switches, we have an off switch, the CTLA4. Okay, so this is what turns off the disease-fighting cells. If you have a mutation here, the CTLA4, hey, the general says, hey, the battle's over, go back and relax. Well, if you have a problem here, you can't turn that army off. They go rogue, and again, they start to what they have called autoimmune diseases like lupus, rheumatoid arthritis, IBD, muscular sclerosis, type 1 diabetes, and even psoriasis can show up. Graves' disease, problems in the thyroid, vasculitis. Big deal here, blood cell problems. All right. Now, the DRD2, another important one that they look at. This is a dopamine receptor, and basically it's a neurotransmitter receiver, and so it's the dopamine goes around and around in our brains, and this is how the brain cells communicate with each other, is through dopamine. And problems here can lead to drug addiction and Parkinson's. Second part of the test is going to talk about chemical detox mutations. CTH here, cysteine. What cysteine is an amino acid. Okay, we have several different amino acids that we use in our body, and this happens to be an amino acid that contains sulfur. And what this will do is it helps maintain the protein structure. It's very, very important in the production of antioxidants, specifically the glutathione antioxidant. The glutathione antioxidant is probably one of the most important ones. Remember we were talking last week about what's the most important ingredient in a recipe. They all are if you run out. But this glutathione is a big deal. All right. Problems with this can lead to seizures, anemia, and intellectual disabilities. That's right. Mental handicap can occur when there's mutation here. So that's one of the things they look at in our beacon carrier test as well. Also ataxia. That could be a loss of coordination. All right. AHCY, again, a lot of these are going to be dealing with this glutathione. This is homocysteine production, souped up version of cysteine. And if you can't produce this glutathione, or you can't produce this cysteine, it's going to wreak havoc on your body. The GSTM1 and GSTM3 are very similar, but basically the GSTMs are going to help the body deal with drugs, okay, how they absorb them and how they detox from those, especially like anesthesia. These GSTM1s, 1 and 3, will deal with how after a surgery our body deals with that anesthetic, and so also how it processes that anesthetic. Helps us deal with the environmental toxins and carcinogens, and the GSTM1 and GSTM3 differences are mainly the GSTM1 deals with the issues in our joints, and the GSTM3 deals with these issues in our nervous system. They're both very important, and mutations in the GSTM1 and GSTM3 have been found in people that have bladder cancer, and with the GSTM3 mutation, also esophageal cancer. That'll answer a couple questions about why can somebody smoke a pack of cigarettes a day and not get cancer, and somebody can smoke less than that and get cancer. Is because there's a gene mutation can also be a factor in that. Then you have the GSTPs, and basically these are found in our skin, in our lungs, in our sinuses, in our bladder, in our intestinal tract. So therefore, it's logical that mutations here can lead to eczema, asthma, chronic sinusitis, leaky gut, and a big word there, interstitial cystitis. Our neurotransmitters and pain control section of the test, very important neurotransmitters. We have a specific test for that that's going to be added if it's not already in the brochures into the store. But this one's going to be dealing with like the COMT. We've talked about this before. And the COMT, it's enzymes, and overproduction of these enzymes or mutation in this can lead to degradation of our neurotransmitters, such as dopamine, very important, epinephrine, norepinephrine, spelled it wrong, anxiety, depression, and even OCD. And so basically not a good thing here. The GAD1, we talked about this one before. Last time we talked about it, I was just kind of focusing on the circadian rhythm. I like this gene a lot, like this mutation a lot, because this one here, if there's a mutation, it's not just what you can see on the screen here. People with these GAD1 mutations, they tend to have a very, very low pain threshold, okay? And the GAD1 is really kind of responsible for converting this glutamic acid or glutamine to GABA. And what GABA is it's a calming neurotransmitter. Problems in the GAD1 genes also, like before, sleep disorders, even constipation. And they can have problems with prescription medicines as well. And that kind of works hand in hand with the next one, the OPRM1. This is the opioid receptor, okay? And what this is going to be dealing with is chronic pain sensitivity, and just like it states in the definition, opioids. So if someone's a hypermetabolizer of opioids, then, hold on, who's not muted? Who is not muted? Okay. There we go. Opioid receptors. So if somebody has a mutation in this gene here, they are a hypermetabolizer of opioids. So therefore, they may appear to a doctor as being someone that's just seeking pain medication. And it means so much more than that. It just means that they have a they're very sensitive to pain because of the fact that they can't process these opioids in their system. So that's going to lead to a higher pain medication dosages. And like I said before, it looks like they're med-seeking when they, of course, they are because they're in pain, but some people take advantage of that. Then we've got our ABCB1, and this is I call this one the PGX gene, essentially. This is the multi-drug resistance variation, and what this is going to be dealing with is exactly that. This is in our PGX tests, both the no-cost and the retail, and it's the same thing in our PET. We have an MDR test for pets, and what it does is this multi-drug resistance is built up by building barriers around our brain and around our gut and it also helps us with getting rid of the excess drugs in our system, and also the excess nutrients like those water-soluble vitamins we were talking, the fat-soluble vitamins that we were talking about before. And also, mutations here can interrupt with the normal development of a human being. So again, developmental issues, that being mental and physical. And so if somebody presents with a mutation here, they're going to obviously recommend a PGX test. And skip the rest of that slide. Again, I'm pretty poor at that today. Sorry. All right, so let's get right into the report. Cover sheet and inflammation control, right? We talked about these things here. So what's important about this part of the report is all of these things that you see up here in the top part of it, these are kind of the on switches for inflammation. So if these start popping up red and amber here, if it's kind of scattered like it is right now, this means that here's some treatment recommendations for those, right? Now, these aren't just things for the doctor to consider, like, one, try this, and then try that, perhaps, if that doesn't work. What a doctor would see if he sees this report is that they've got a few switches here that are turned on, okay, and some that could possibly be turned on with other factors. And so what they may do is they may say, let's try some CBD, okay? CBD, people use it for pain, right? We know that is one of the reasons. And so they'll say, let's try CBD, but let's not get confused. That's this person's report right here. CBD may work for a little bit and then stop working. And so what they'll do is they'll combine some of these therapies. They'll say, try CBD oil in the morning, okay, and then at night try something else. Okay, so they may flop them around and give them more than one option here for that to handle those inflammation switches. And again, down here, remember this is our off switch. So if this one is being like a red, for example, that person has a really good chance of having an autoimmune situation. Their body's going to eat themselves. There's the chemical detox SNPs that they're looking at. And again, this glutathione, okay, it kind of makes sense, right? If we got a problem with the glutathione production, they're going to recommend a glutathione supplement here. Then we've got some other recommendations here, and then look at this, herbicide and pesticide avoidance. Okay, again, what they're recognizing here is that your genetic makeup can, your pain and your inflammation is absolutely affected by outside factors. It's not just what's going on inside our bodies, it's what we're exposing ourselves to with chemicals. Down here we have the neurotransmitters part. And look at some of these recommended, the SCAD1. Okay, this is taking those glutamic acids, and there's problems here, so look at what they're recommending here, some GABA. Okay. And some other name brand drugs or supplements. And then down here, here's our opioid receptor, and look at that. It's not good. So it defines the sensitivity to those opiates. See, look at this over here, lifestyle recommendations. Expect lower than normal response to opiate medications. Will most likely need higher dose or stronger opiates for adequate pain control. And again, consider the PGX testing. Let's go back up and see what other lifestyle recommendations here. Wow, lots and lots of stuff. So this test is very, very complicated, of course. So here's a summary page of the highly recommended therapies and some of the formulas from a specific company here. But these are really good things. Now, let's get back to how can this help with fibromyalgia? Okay, how can this test somebody? How can it help them with their fibromyalgia? Well, again, remember the only way to determine at this point in science if a person really has fibromyalgia is to rule everything else out. Well, this test is going to help the doctors rule out the other problems, and it's going to shortcut some of these tests. Of course, they're going to do a full blood workup on them, but when they can see the genetic code and the genetic makeup of that person, they're going to be able to more quickly, eliminate those other things. And again, it comes with some definitions and disclaimers. So I'm going to go ahead and stop the recording, open up the lines for questions.